Now that you know how and why you develop kidney stones and how it feels to have a kidney stone, I think it's only pertinent that we talk about ways to prevent having those stones. I think that's like the most important thing, because having the knowledge about something and knowing what it is and not know, or rather knowing that it is also harmful and then not knowing what to do about it, I mean, it doesn't make any sense, does it? So I'm going to dive into ways to prevent formation of stones. So in my earlier video, I mentioned that we have basically or majorly 4 types of stones. That's the calcium stones, the uric acid stones, the struvite, and then the cystine. Now I'm mentioning them in order of how common they occur. So the commonest stone we have is basically the calcium stone, which can be calcium oxalate, it can be calcium phosphate. One most important pathway to form stones is having concentrated urine, which results from little hydration. So in a day, you should take at least 2 to 2.5 or 3 liters of water. That's enough. You know that besides intake of water, the food we eat also contains water, so that also goes a long way. So just ensure that you are adequately hydrated. One other thing is, once you are pressed, once you feel the urge to urinate, please go and urinate. Basically what I'm going to be talking about are just lifestyle modifications. There are things that we'll do or not do that will help us to prevent the formation of stones. Now, for the commonest type of stone, which is the calcium stone, is usually as a result of excessive calcium in the urine. Now this comes about by either for individuals who are having maybe some disorder such as hyperparathyroidism, where there's excessive calcium, and then at the same time you are not taking enough you're not having enough intake of fluid. Of course, that excessive calcium has nowhere to dissolve in. And then also when you are also taking a lot of oxalates. Now foods rich in oxalates would be our green leafy vegetables. We are advised to eat a lot of vegetables, but again, everything we do should be done in moderation, because too much of everything, as the saying goes, is bad. So you take for your green leafy vegetables, spinach, too much of it, of course, will give us excessive oxalate. And then also some of these nuts that we take, things like beetroot, you can try to find out foods that are rich in oxalates so that you take them in the appropriate or optimum proportion. So once there's excessive oxalates, it's going to bind with calcium to form stones. So for calcium stones, again, ensure that you're taking enough water, and then you take your oxalate rich foods in moderation. And then if you're having any disorder that has to do with calcium metabolism, of course you see your healthcare provider for that. Now uric acid is a byproduct of protein metabolism, so it means that protein rich foods will cause production of uric acid, and when taken in excess, especially our red meat, it's a very potent or is a very important source of uric acid. So it means that again, it's only eat those things in moderation, because these things are important. We need them for bodybuilding, but at the end of the day, anything that is not done in moderation eventually becomes a poison and becomes harmful to your body. Then next in line is the struvite stone. Now struvite is the stones usually form as a result of recurrent urinary tract infections. So when certain organisms like Klebsiella, like Proteus, Pseudomonas, when they act, they produce things like ammonia. Now it also lowers the pH of the urine. So the urine ideally is acidic, so but when it increases the pH of the urine. So when the pH of urine is increased, it makes the urine alkaline, and it's a further breeding ground for organisms. And then also, because of the alkaline nature of the urine, you have things like ammonia, magnesium clumping together and forming a stone. Now that is where struvite stone comes from. So once you have any form of infection, or once there's something that feels like an infection for the urinary tract, you see your healthcare provider so that it's treated, and then these things don't occur. And also these things happen due to the fact that sometimes, as I mentioned earlier, we like to keep in urine. So when you are pressed, you allow it to stay there, and then stasis of urine allows for bacterial growth, and of course those bacteria will act and then produce those things, and then the cycle continues. And then lastly is the cystine stone. Now for cystine stones is usually as a result of a rare genetic disorder called cystinuria, and with that the body is unable to absorb the amino acid cysteine basically, and so you have it in excess in the urine and then it forms stones. So by and large, for cysteine stone, it's not necessarily something you do or do not do, but if you're aware of having, or if you're aware of that condition, or it's something that you have, of course you see your doctor, and from there you know what next to do. Having said all this, so it means that lifestyle modification is very important. Taking adequate water, as much as your body needs, as long as you are thirsty, you take. Urinating as at when due. Once you feel pressed, you urinate, you do not hold it in. Ensuring that you eat your meals in moderation, you eat your vegetables, you eat your proteins in moderation. Ensuring that once you have a symptom of a urinary tract infection, you immediately see your doctor and get it treated, so that it does not prolong, it does not stay there for long and then eventually form stones. So I hope that this goes a long way to help us, so that we prevent this painful occurrence. And if you have other ways, if you have other means in which we can prevent these things from happening, please put it down in the comment section. It will go a long way to help someone, but I think these few I have mentioned will actually do most of the job. And yeah, thank you for staying with me up to this point, and I'll see you in my next video.